we're going to talk about medication administration, specifically avoiding errors in medication administration. So giving medications is kind of one of those defining elements of being a paramedic out in the field. And if you give medications, it can correct or decrease the severity of an illness or an injury. It can help manage or stop a life-threatening problem. And it can greatly improve their overall well-being by just, reducing their pain and discomfort. With all of that, if you make a mistake, you can kill them. You can have life-threatening consequences for your mistake. So it is absolutely imperative that you minimize any possibility of medication error. So medication decisions are a lot of times based on memory, and so when we're trying to remember this dosage, especially for something we have not given frequently, and we're in a stressful, high threat level situation, it's very easy to make a cognitive mistake where you choose the wrong drug, or a technical error where you have the right drug, you know the right dose, but you draw up the wrong amount or administer the wrong amount. So there's a couple of steps you can do to try to minimize these errors. So the first one is to perform a verbal readback of the orders. If you're with a partner, say, I'm thinking of giving XYZ drug, this much of the XYZ drug, and make sure that they're on board and that this is the right thing. Say the medication name, say the medication dose. If you draw up medications, label your syringes. You don't draw something up and set it down. If you're not giving it right away, label your syringes. That is absolutely important. You've got silk tape in your bag somewhere with you. Label your syringes. All right. Bring along any of their home medications if you can do so safely. Now, if it is something that stays in the refrigerator, don't bring those. Maybe take a picture or something. Take it with you, but don't bring those. Use a reliable reference source. Make sure you're not just going to Joe Blow's, drug resources. Make sure that you're using a validated, peer-approved reference point, whether it's an app or a website. Okay, and then always do a cross-check and have your partner confirm the dose. I'm looking at giving X amount of this drug. I've got the concentration of this, so I'm giving this much volume. Can you confirm? Have them look at it and see and double-check that you're doing this right. Some of the more common errors you may see, a trailing zero after a decimal point, don't do it, because that decimal point can disappear and it can multiply the dosage in that the patient's going to be given. We don't want to do that. No leading zero before the decimal point, same thing, that 0.0 or something, it goes away, and then you end up, instead of 0.8, you end up with 8 milligrams, which is a lot more medication. All right, using non-common abbreviations can end up with the wrong drug. Some things like the route or something, subcutaneous could be, depending on how their handwriting is, could be misinterpreted as sublingual or something like that. So always make sure that you are, if you're writing out orders, if you're interpreting orders or you're giving orders, that you are minimizing any possibility of creating an error. So when we talk about medication errors, we always want to make sure that we have the 6 rights, okay? There's a few extra there, yes, but mainly the 6 rights. So the right patient, make sure this is the right patient. For us, that's usually not too bad, but what we're looking at is this right for the patient? Is this the right medication to give to this patient? Do we have the right dose? Are we giving it the right route? Some drugs have multiple routes that you can pick from. Is this the right time? And then, of course, the right documentation and reporting. Drug mistakes happen. If it happens, you need to report it. Do not be afraid of getting in trouble to not report your medications, because it could have a life-threatening consequence for your patient. Okay, always be honest if you make a mistake. Now, the extras there, the right assessment. Make sure that we're assessing this patient correctly and we know that this is, in fact, the medication they need. The patient has the right to refuse. Okay, make sure that the patient understands why you feel that this medication is in the best interest. Make sure you've done a proper evaluation for the patient. For instance, nitro. We know we can't give nitro if they've had erectile dysfunction medication. So we'll make sure that we do a full, proper evaluation before we give the medication. And then, of course, the right patient education, letting us know if something changes. So when we are giving medication, we want to document the following things. We want to document the dose administered, how much we gave, how we gave it, the route, how fast we gave it. Was it a fast push, slow push? Was it a drip? Was it over time? We want to document the name of the medication. We want to do the time of administration, who administered the drug, and the patient's response, good, bad, or ugly.